Greetings, everybody. I'm really grateful that you joined us today. We are looking forward to spending some time sharing information about the work that CHCF has been doing with HealthBegins and Aurrera Health Group to support community-based organizations in developing partnerships with California's managed care plans. Just quickly, before I turn it over to Sadhana and Rishi, I wanted to share just a little bit about the California Healthcare Foundation and why we're engaged in this work. I think many of you are familiar with the foundation, but just briefly, California Healthcare Foundation is a healthcare philanthropy. We're based out of Oakland and Sacramento, and we're dedicated to advancing meaningful, measurable improvements in the way the healthcare delivery system provides care to the people of California, particularly those with low incomes and those whose needs are not well served by the status quo. 1 out of 3 Californians lives in or near poverty. Because people with low incomes face the biggest health burden and the greatest barriers to care, our priority at the foundation is to make sure that they have access to high quality care. We recognize the historical and continued oppression experienced by Black, Latinx, Asian, Pacific Islander, Indigenous people, and other racial and ethnic groups. That is why we also work to create a healthcare system that is designed to redress and not perpetuate the inequities that too many of our fellow Californians face. One of the best opportunities that California has to advance that work is to strengthen Medi-Cal, which is a cornerstone of California's safety net. Our work in Medi-Cal is focused on getting people covered, making care just, and delivering better care. When we approach this work with HealthBegins, we recognize that as the state started to manifest its vision for CalAIM and the future of Medi-Cal, community-based organizations were going to play a critical role. And yet we were hearing from a lot of people that they needed support to make that vision a reality. So HealthBegins started a conversation with many of you. We wanted to understand, both from the perspective of CBOs, community-based organizations, and managed care plans, what you needed to be able to more effectively partner with one another. Those conversations then formed the basis for this work, which I'm going to turn it over to HealthBegins to explain.
Thanks so much, Carolina. And I will ask Rishi to jump in here and give a little intro while I share screen with the rest.
Thanks, Sadhana, and thank you so much, Carolina. Hi, everybody. Rishi Manchanda, I'm CEO at HealthBegins, and you'll hear more from Sadhana and the rest of the team as we go forward. First, a little bit more about who we are and our partners at Aurrera Health Group. I won't read everything on the screen here, but in some, HealthBegins is a national mission-driven consulting and training firm. Our focus, our mission really is to drive radical transformation in health equity. And we do that by working with partners to improve the social and the structural drivers of health equity. A big part of that work, as consistent with what Carolina mentioned as well, is focusing on building the capacity of cross-sector partnerships, especially clinical and community partnerships between healthcare, in this case, health plans and CBOs. We're really privileged to work with Aurrera Health Group, which has deep expertise, especially across the nation, but especially within California at the state Medicaid policy level. And Aurrera Health Group has been doing a lot of great work, working closely on supporting some of the provider education around CalAIM. Again, we're privileged to have them as a core partner in this work. As we go to the next slide, we wanted to just briefly introduce the objectives for today. We hope by the end of this session, this informational session, that each of you will be able to better describe the goals for this work, this CalAIM Medi-Cal CBO Partnership Development Network. We also hope that you'll be able to describe, many of you are likely very familiar with CalAIM to a certain degree. We hope that you'll be able to just briefly describe the community supports, what was formerly known as in lieu of services, or ILOS. We hope that you can describe those types of community support services and the Onramps that we've identified through extensive conversations with stakeholders across the state over many months. We'll also touch on some core capabilities. Hopefully you'll walk away with a better understanding of what we've heard from managed care plans directly about some of the core capabilities that they're looking for with community-based organization community-based organizations that can provide support, including community supports for Medi-Cal beneficiaries. And lastly, we'll identify some opportunities to stay involved in this work and also keep us informed about the work that you're doing. We also recognize many of you are likely involved in current efforts at a local or regional or even statewide level to provide technical assistance to support these cross-sector partnerships. And we hope to, if we haven't already been in touch with you or vice versa, to open that dialogue today to learn a lot more about what's happening across the state. So we go to the next slide here. We wanted just to underscore some of the basic assumptions about who you are today. We assume, and it looks like in the chat, we're validating that this assumption that many of you are either California-based community-based organizations or your accompanying organizations that support California-based CBOs. We assume that many of you have, at least at a high level, understanding of CalAIM and also have an understanding of the specific benefits of enhanced care management as well as community supports. And we also, lastly, but not least, assume that you're here today to learn more about opportunities to develop these partnerships and relationships between managed care plans and CBOs. So with that, I will turn it over back to my colleague Sadhana now to walk us through some of the objectives for today. And thanks again for joining us. Oh, Sadhana, you're on mute, sir.
Thanks, Rishi. I was just commenting that I lost my share screen for a second here. So as I refined that, I had a little Zoom issue. Let's see.
I can share screen too, Sadhana. Let me know if that's.
Yeah, I think that would be helpful.
Okay, no worries. I will do that. And let's go into the view. There we go. Can you see the screen now?
Yep. Thank you so much, Rishi.
All right. Yep.
So I'll take us through some of the goals that we have for this work. So if you go to the next screen, I think folks really set the stage well here with Carlina and with Rishi in terms of the promise of CalAIM. We really recognize through all of the kind of stakeholder interviews that we did earlier this year in pursuit of the design of this project, that strong equity-oriented CBO, MC, and managed care plan partnerships are critical to ensure success of CalAIM, and of course, beyond CalAIM as well. This is something that this has kind of become a common refrain. We know that equity is important for these partnerships, even beyond CalAIM, for the health of our state. We see this across the country in all of these regulatory efforts. It's important for behavioral health integration here. It's important for ACEs Aware here and all other state and regional health transformation efforts. And so we're really trying to center that in the work that we do here. We also see that, healthcare entities have a lot of support infrastructures, right? They have MSOs, they have IPAs, but CBOs really don't have something like that to help with these infrastructural needs in order to partner with managed care plans in under constructs like CalAIM. And so this lack of coordinated CBO support and infrastructure really impacts partnerships and leads to a lot of what we've seen in terms of frustration, avoidance, and limitations. And so in order to kind of work through that, if you go to the next slide, we were granted this award by CHCF earlier this year to talk to key stakeholders about this landscape and to create an inquiry and design process to test out a couple hypotheses on how we could improve the capacity of CBOs and managed care plans to partner better in true partnership that is equity oriented. And so if you go to the next slide, what we've learned from that process earlier this year was what's resulting in this CalAIM Medi-Cal CBO Partnership Development Network. It's gone through a couple of different names, so you might have heard of it through different ways, being called different names throughout this year. But this is where we're landing for Q4 of 2021, and it's really designed to accelerate and align partnership development alongside the rollout of ECM and community supports. So if we go to the next slide, over these two slides, what we are hoping to lay out are the partnership network goals, and we see goals to support CBOs as well as goals to support managed care plans through this work. And so what we're hoping is that through this kind of TA experience, CBOs will be able to describe essential components of Medi-Cal and related terms. They'll be able to assess their own strengths and readiness and areas for improvement. Something that we heard kind of across the board was, just understanding where we are is going to be important for partnership, and understanding where gaps exist is really important, and that there isn't an existing great way to do that. And so this assessment piece really rose to the top in terms of ways that we could support. We want to help develop knowledge and skills to be effective partners and to really strengthen relationships. We see this as a way to help enhance conversations between plans and CBOs. And ultimately, we are hoping to help CBOs draft a plan that their organization can take to address, to pull in all of these pieces together, to take that assessment, to understand their readiness, understand their gaps, and help support strengthen contracting relationships. And if you go to the next slide, yeah, thank you. The managed care plan side, we also see value here and goals that we can address for managed care plan managers and staff. So that assessment piece sounds like it was still important on the managed care plan side to better understand what's the capacity and level of readiness of local CBOs. We really want to strengthen.
Here to your left and then to your right. Yeah.
I'm sorry, I think someone might need to mute. Thanks. And then to strengthen those relationships, so really a corollary to what we're seeing and we heard from the CBOs and that we're hoping to support is to strengthen relationships with CBOs, especially those that have services that align with ECM and community supports. We want to define current capacity for this provision of ECM and community supports, and support any incentive performance measure goals. And some of this might seem a little jargony, but we're hoping, over the course of our TA, we can, dive deeper on like incentive performance measure goals and the incentive funding that might be available through CalAIM. And really managed care plans kind of finally landed on, being able to reach a larger number of CBOs about what CalAIM is and the requirements are in support of this effort kind of all at once. So this cohort experience was something that would be of value. And so that's something we're hoping that we can deliver on through this project. And the way that we're planning to do it is on the next slide. Yeah, exactly. Thank you. And so from now through the end of December, we're going to host 2 statewide sessions. These will be open to all CBOs across the state. So if you're a CBO on this call, you can join those statewide sessions as well. We heard through that inquiry and design process that we really needed to provide something to help CBOs come along on this journey as CalAIM is being rolled out. And so we're trying to align with existing TA that is being offered by DHCS and Manat and Aurrera and other kind of TA providers across the state, help amplify those TA efforts and then see where we can plug in on TA needs. And we'll be asking you all a little bit about those TA needs as well in this session. And then the heart of this is really some regional intensives. And we've been developing these with managed care partners. And so for this period between October and through the end of December, we're focusing in on 4 counties, the ones you see on the screen: San Joaquin, Stanislaus, Shasta, and Sonoma. And we'll be having some cross-regional TA in those 4 counties, and then also some county by county technical assistance where the managed care plan partners will be able to help us deliver those technical assistance pieces that are really kind of plan specific. If we go to the next slide, I'll kind of pause here and ask Rishi for you to kind of jump in on this next section to help describe the potential opportunities.
Thanks, Aldana. Thanks so much. I also see some great dialogue happening in the chat as well, and so really appreciate and encourage the kind of the connections. There's really some already both information about who you are, but also some people are starting to share what they're doing in regard to building out this infrastructure for CBOs to engage with managed care plans. What we're going to share here may build on what some of you or many of you are already starting to see or advance in your work, and those are potential opportunities for CBOs, especially when it comes to the CalAIM community support benefit or services. One of the things that we had done, as Aldana mentioned, earlier this year with support from CHCF, was to do some deep dive conversations with a number of stakeholders across the state to try to get a sense of the different on-ramps, the different opportunities for CBOs in particular to engage in these types of partnerships. And as you can see here, there's several paths or on-ramps that we had learned about and started through conversations and through validation that occurred over a number of conversations, including a focus group that we ran. And these on-ramps are both on-ramps for enhanced care management or ECM services, as well as for what was previously called in lieu of services or community supports. And you'll see that at a high level, without going through each one of the things that emerged was this direct versus indirect type of set of on-ramps. That in some cases, some CBOs may choose after their own assessment of readiness and capacity to pursue a direct contract with a plan or with a major provider to become an ILS provider or a ECM provider for that matter. There are other models that we heard about and put on, as you can see here, which are indirect models. For example, models in which the CBO may decide that they want to engage because they have services, high value services to offer in alignment with community supports or with enhanced care management, and believe that to pursue that, though, instead of becoming a direct contracted provider or entity with the plan, to instead become either a subcontractor to another provider that will be recognized in the provider network for community supports or ECM, or besides being a subcontractor, maybe work with an intermediary. And we know that there are some efforts in different counties across the state to develop intermediary types of models, including MSOs or other types of examples of intermediaries to support CBOs that can provide high value services, but may not necessarily have that may decide not to build up the administrative capacity to contract and provide the data sharing that's required under the reporting requirements under CalAIM. And so the point is that there are different on-ramps, and what we've learned is that there will likely be a wide variety of different on-ramps that are pursued within each county, particularly because we recognize the different structure of Medi-Cal managed care in each county. The question for us was how to provide TA to be able to accelerate, as Aldana laid out with our goals, how to accelerate the assessment of readiness for the CBOs, and also how to improve the readiness of CBOs to be able to pursue either direct or indirect kind of on-ramps in these kind of partnerships. In particular, what we've learned, especially through the work that's happening in this quarter, is that it seems to be most relevant of these questions of on-ramps and how to accelerate that readiness, relevant for community supports in particular. And so this is a recap of what many of you are probably familiar with, but just to state for those who are just earlier in the journey, we know that what DHCS has identified as medically appropriate and cost-effective services, what was previously again called in lieu of services, is now called community supports. We know that there are 14 of these medically appropriate and cost-effective services that are put forward under CalAIM. And you'll see them listed over here. There's a good variety of housing-related community supports, as well as recuperative care, respite care programs, for example, environmental modifications, food security-related interventions, such as medically supported food or medically tailored meals, and so on. You'll see there's a good spread of social services that, again, we assume many of your CBOs either have deep experience in providing or are in partnerships that provide these services. We also recognize, of course, that many CBOs provide more than the services listed over here. And so This is, again, what CalAIM has identified as medically appropriate and cost-effective services that they have included under CalAIM. The question really is with these on-ramps, and especially on-ramps to be able to potentially provide community supports in partnership with managed care plans, what are the core capabilities that the plans are identifying that will be necessary, both especially for direct contracting opportunities? And so with that, I'm going to turn it over back to Sadhana. I'll also flag that I think in the chat, if it's not already in there, the description about community supports, the deeper description of CalAIM, there's a lot of questions that might be out there. And so what we'll do in the chat is provide you links to what DHCS has provided in terms of information for providers in general about CalAIM, including a description, a more in-depth description about community supports as well as ECM. So please look for that in the chat before the end of today. But with that, I'll turn it back over to Sadhana.
Thanks so much, Rishi. And I did include those links in the chat. I just reposted the last one on in lieu of services information through DHCS as kind of primers. So if you go through the chat and check out the links, you'll be able to see some of those primers that have been made available through DHCS and can hopefully help with some of the initial sorting through of terms and how things fit together. And I also welcome kind of the chat that's happening in the chat. I saw a couple of questions and also just communication about where organizations are and what you're advocating for. And so that's all really great. And especially in terms of questions, we're going to kind of wrap up this section pretty soon. We will leave time at the end for questions and answers. So please continue sending those in the chat. So if we go to the core CBO capabilities, if we go to the next screen here. These were core capabilities that came up through our conversations with CBOs and managed care plans over those first few months of the year here as really rising to the top. And so before we kind of reveal what we heard from our stakeholders, we're interested in hearing what you all think. So a poll should have launched on your end asking, which are the top 2 domains that your organization would like to see covered in a learning session. And so we list these out here, and I'll leave them open for a little bit for folks to start selecting. It's multiple choice. So you should be able to. And we've got good responses coming in, so I'll give us a little bit longer here. One piece of feedback that we received a lot was like, it's hard to choose between them. We need it all, which we definitely understand. And so I appreciate you stepping into this exercise with us. And so I will close the poll in 5, 4, 3, 2, 1. Okay. Got some good participation here, and hope you all can see these results on your screen. It sounds like the top one was on understanding Medi-Cal managed care and CalAIM. So, really that primer work seems to be most important to folks on this call. There's kind of a neck and neck between data sharing, contract billing, claims adjudication, and compliance. Which is not surprising, and then a little bit of drop off for the rest. Contracting is kind of close behind, and then business case development, workforce requirement skills, those are kind of coming in later. So if we go to the next screen, these 3 pieces on data sharing, contracting, contract billing, claims adjudication, and compliance were the ones that really rose to the top in terms of those regional intensives. So as we mentioned, there's 2 statewide sessions that'll be a little bit more general information. We are hosting at the same time these regional intensives. And so these 3 that kind of landed as like the second, third, and fourth highest ones in our impromptu poll here are the ones that our regional sessions will be focused on. And it's really because, we want them to be we're going to be partnering closely with the plans in those regions to be able to get to the nuances and the kind of intricacies that might be kind of county specific or plan specific related to these topics. If you go to the next screen, and we'll be sharing this deck out afterwards, you can see the topics that we envisioned within these domains. And so for these first four, we're not intending to leave them behind necessarily. We do see these as potential domains and topics for those statewide sessions in particular, and because of kind of how more generalizable they can be across the state. And if you go to the next slide, we will focus in on these for the regional sessions. As we've kind of been saying, we're testing this out to see if this is the right kind of distribution. This is what we've been hearing. And I also want to say that we're not planning to cover all of this. These are just a couple of sessions statewide in the regions and per county over the next couple of months. So we'll be prioritizing among these for the next few months to see what's really rising to the top, even among these being listed here. So if we go to the next slide, there are opportunities for everyone here to stay involved in this work, in one way or another. And so we will kind of close out with this section on how to stay involved. So between now and the end of 2021, we'll conduct 2 high-level statewide learning sessions, and we'll have the dates show up in a couple slides from here. If you go to the next slide, there's regional intensives as well, and we'll work in those 4 counties. Specifically at this time, I know, Elle, you had a question in the chat about, what about, I think it was Inland Empire that you raised. I think there's the possibility for future work in other counties based on, what we're doing here. And right now we're just focused on the next couple of months with these 4 counties, but we would appreciate feedback from CBOs if you would like to see this in your counties. If you think this is of value, definitely let us know and be in touch about that. For the time right now, these are the 4 counties that we'll be working in with those regional intensives. What we're hoping to do there is identifying and recruiting 8 to 10 CBOs for each of those counties. And we'll really want to focus on equity, focus on alignment between the managed care plan and CBOs. We're going to conduct some readiness assessments that we've reviewed with our team here, as well as the managed care plans. And then, as I mentioned, those topics that we flashed on screen earlier are really a menu. So we'll select together the curriculum topics based on those readiness assessments, based on the previous conversations that we've had leading up to that point, which are the topics that need to rise to the top over the next couple of months. If you go to the next slide, you'll see these are the dates that we have. We have the first statewide session coming up on November 17th from 3 to 5. And if you registered for this webinar, we'll certainly send out the invitation for that statewide session as well. We're still landing on the date for the second session that will happen early December. And these statewide sessions, like we mentioned, are open to everyone on this call. The regional sessions will be open only to the CBOs in those 4 counties. And so those will be taking place in November. We do intend to, somehow share any learnings from those sessions with folks, but we will only be opening those to the 8 to 10 CBOs that are selected per county in those 4 counties. And then I think our last slide is just to acknowledge the work of the team so far to getting us to this point, to getting us started on this work over the next couple of months. It's been a lot of moving parts, and just wanted to express our gratitude to our friends at Aurrera Health Group, at CHCF, as well as our implementation partners through Transform Health, through El Sol Neighborhood Educational Center, and Mount Auburn Associates. So with that, I will take a breather and go to chat to see if there have been any questions that have come in here. And I don't know if my HealthBegins colleagues have seen any questions that should be raised up here.
I'll voice over a couple, Sadhana, thanks. Saskia, hopefully I'm pronouncing that right. Apologies if not. Oh, perfect. You asked, and it sounds like we've answered that question, Saskia, about the dates. Wonderful. And I also wanted to call out that Carlina had put in some additional primers and explainers regarding CalAIM in the chat. You can see that as well for those who are looking for more background. And then I think there was a question that you had answered from Elle regarding Inland Empire as well, but those are the questions so far. And then date for session 2 for the second statewide session, Elle. Yeah, Assad, if you want to take that, I think that's TBD.
Yeah, so we're still trying to find the best date among our team. It's likely going to be early December of this year. We're just trying to stage it with all of the other sessions, and we'll certainly send that out to this whole group as we get that squared away. And so I'm seeing a question here from Saskia. Thank you for that. So who do folks contact if you're interested in participating in the CBO cohort in Sonoma County? I think there's 2 routes here. If you, in Sonoma County, we're working with Partnership Health Plan. If you have existing relationships with them, please feel free to reach out to them. You should also reach out to us. And so, we'll add our emails in the chat at the end of this, and you can reach out to us with that interest. We will have a post-event survey at the end of this webinar, and we encourage you to fill that out because we ask those questions exactly. Is your organization interested in attending the statewide TA session? Are you interested in the regional session? And we can match it with the county served that you've entered in your registration. We're also asking through that survey, if you're interested in serving in an advisory committee kind of capacity for this work, and we can keep your name for that as we kind of pursue that. I received a direct question here that mentions that from Michelle Liu so as a CBO, we're recognizing a need for legal review of health plan contracts. Could that be an area for future technical assistance? And I think absolutely. I think something that we've heard, and this might fall even within the contracting domain, depending on how we interpret some of those topics. Something we've heard from actually plans and CBOs alike is the need for assistance in legal review, for the need in terms of some internal advocacy around legal review, and how to interpret legal kind of regulations and restrictions for what they are when they are restrictions, and when they can be interpreted creatively to allow for some partnership enhancing mechanisms. So I take note of that and think it's a great suggestion. And
I think to build on that, and maybe to turn to the entire incredible audience that we have here today, just want to remark on the fact that we have almost 200 people, or more than 200 people at one point, that have joined. So really appreciate the level of engagement on this, especially given that many folks just heard about this in the past 24 to 48, 72 hours. So really appreciate that. One thing that question kind of tracks for me or raises for me is that we're talking about these TA sessions, these regional sessions in particular, and the statewide sessions as opportunities to address to CBOs that are seeking information. But I also recognize on this call that we also have CBOs and others who lead accompanying organizations that provide answers to some of these questions, whether it's legal review, others. And so I wanted to just get a sense in the chat, if you're an organization that also provides a TA or is already currently kind of working within a region or a county within California that's helping to provide TA. It may be domain specific TA, for example, for food security or for housing or asthma, et cetera. It may be population specific for a certain age segment or type of patient population in terms of complex care. the point being, if you're a provider of services and not just a seeker of services for TA in this case, please feel free to enter your information in the chat as well to let others know, particularly because that's the purpose of both the specific regional sessions and the statewide sessions and the overall vision for this Medi-Cal CBO plan partnership development network, right? It's really meant to help facilitate the connections that already exist. So please do feel free to enter information if you are a provider of TA services or you're working on things you want to highlight for the group. Thanks. Kitty was asking a question about what the status on contracts are around the state. We've only seen one ECM contract thus far. Southern, I was wondering if we could invite Kitty just to unmute and voice that over a little bit, and so we can.
Am I off mute now?
Yep.
Oh, okay. Hi, everybody. So we're anxiously awaiting, we're a GMC county, of course, so we get to have a lot of ECM and community supports contracts that we're waiting on. And so far, we've only seen one ECM contract and started to evaluate it, look at the rates, see what the challenges and opportunities will be, how it compares to the health homes program contracts that we've been operating under. And, obviously very anxious to see the other contracts and just wondering how we are comparing to other regions in the state in terms of starting to see what those contracts look like. I know there might be an opportunity through a network like this to share some knowledge around how to best, I know we have to be careful when it comes to discussing contract specifics, but there are definitely opportunities to keep each other abreast on where our contract's heading and are they covering our costs? Are they, really going to work for the CBOs? And that's something I'm anxiously awaiting to see the rest of the contracts coming out.
Kitty, thank you so much for that question. Just my quick reflection on that is, I think encouraging again the kind of the crowdsourcing of answers so that you might see some other pings from across the folks on the line today. So please feel free to, if you're seeing contracts around the state, especially between CBOs around ECM and or ILOS, please do share that. And Kitty, the other kind of quick reflection is the point you made about the network, the potential benefit of this network. And I really appreciate that comment because that's exactly these are the assumptions, the hypotheses that we're bringing to this group. We're HealthBegins and Aurrera, the approach we've taken from the beginning is to generate hypotheses that are coming from conversations with everybody and then quickly put them out there to validate and invalidate them. And that's where we've come to with this idea of this network that seems like it may support, to your point, Kitty, the ability to share notes where, with all the sensitivities, considered, share notes and facilitate the sharing of information around contracts. So Kitty, thank you for that. And I don't know if I reflected back accurately what you're getting at in terms of how this network might help.
Yes, very much. Thank you.
Yeah, thank you.
Yeah, and I think that's great. And so if folks did have, responses to that, feel free to enter in chat, what your experience has been. To Kitty's point, I am also seeing a number of folks representing organizations that are providing TA assistance chime in on chat, which is really helpful to see those. Marin Community Foundation, Transitions Clinic Network, Nonprofit Finance Fund, Mathematica, Aging and Disability Business Institute, right? So just want to encourage folks to continue sharing on that front as well.
And for those who have been entering, and this is wonderful to see, for example, Catherine and others, please do mention the network. For those who aren't familiar with your name and attached to the organization, please do indicate the organization if you haven't already, so that people can see which organization is providing which TA. So I encourage you to use this opportunity to identify how you might be able to support. Thanks.
That's great. And so I'm wondering if there are any other questions as well.
Great. Do you want me to share a screen and kind of for the wrap up?
Sure, Rishi. Thank you. And so that slide you had just put on the survey questions, there will be a post-event survey, and these are the questions that we'll be asking. So really invite you all to take these extra minutes to answer these questions. Let us know if you're interested in attending the statewide sessions and participating in a regional session. With registration, we did ask which counties you're serving, and so that'll help us do a little bit of matchmaking. If you're interested in serving on a CBO advisory committee for this work as we move forward, as well as if there's questions that come up for you that you would like answered during one of these upcoming TA sessions, particularly the statewide ones, we invite you to let us know as well. So I think that's it for us today.
So I'm going to just want to flag, there's a couple of other questions that came in, so maybe we can spend a minute before we do. Yeah, just let's see if other people have answers for these. One is Kent's question. ILOS services seem straightforward. How are ACM services going to be contracted? It's a great question. There's also Karen's question about wondering if any organizations, any folks who are in network of care grants through ACEs Aware are integrating these contacts information. So that's another great question. We've seen some of that conversation come up. So we also have curiosity about the answers to those questions. And then you're seeing a few others who are indicating interest in response to these questions already. So I want to encourage people to who've already shared some of their interest in the chat to also complete that post-event survey, because that'll be the most efficient means for us to make sure that we're getting the interest. But encourage everybody to look at the chats. Catherine, thanks so much for your question as well about can we share the chat out? And I think the answer is absolutely yes. We'll follow up with a link to the recording, Sadhana, right? And Asra,
right.
As well as the link to the chat text. And I guess it's a good sign that there's too many comments to keep track of in the chat.
That's right. We can send out both. It might take about a day for us to get the recording and the chat together, but we'll send it out to all registrants of the webinar.
My last question for the group, Sadhana, before I turn it to you to kind of close this out, is was this helpful? +3, -3. +3 being this was helpful, all the way down to -3 in terms of not helpful at all. Just give us some feedback if you won't mind. Just to let us know if this was a helpful session. Again, we're interested in always making sure that we're providing a value here. So feel free to share that in the chat, but Sadhana, back to you.
Thanks, Rishi. And yeah, with that, we will close out. As you exit, the survey, I think, will be sent to you. And thank you all for your time today. We're looking forward to keeping you engaged in the weeks ahead. And we'll be emailing you, as we mentioned, the kind of wrap-up materials, as well as information about those future sessions as they come together. Thank you all.